Good afternoon, everyone. My name is Yaozu He. I'm a clinical doctor from Guangzhou A People Hospital, Guangzhou Medical University, Guangdong, China. I'm very excited to represent our team to share the research with you. This is the outlines of my presentations. Firstly, I would like to introduce the background quickly. HIV and HPV co-infections are not uncommon. By the end of 2021, about 2.7 million people have both HIV and HPV co-infection. The rate of co-infections varies across different regions and countries, ranging from 5% to 28%. And as we can see the graph from the right side, it's a data from China. HPV is high prevalent in HIV individuals in China, especially in the central and northern regions. HIV and without treatment, HIV and HPV co-infection individuals are at high risk of developing cirrhosis and end-stage liver disease when compared to HPV mono-infection. So antiviral therapy is very important for the HIV and HPV co-infection patients. In recent years, some study focus on the HPV seroclearance, which is a marker of the functional cure in HPV infections, which can notably improve the prognosis. But the study varies, the rates of HBsAg seroclearance vary between studies. Data of HBsAg seroclearance in HIV and HPV co-infection individuals is notably scarce in China, particularly in southern regions. And this is our study 8. In this study, we aim to investigate the incidence and factors associated with HPV seroclearance under HPV ART in a large HIV and HPV co-infected cohort up to 11 years of follow-up in southern China. And this is our study flow. We retrospectively enrolled nearly 80,000 patients from 2009 to 2019 and collect their baseline data. We identify 1,550 patients with HBsAg positive, and the inclusion criteria was on the left side and the exclusion criteria on the right side. We exclude some patients for missing baseline data, follow-up time less than 3 months, acute HPV infections, and finally align a cohort of 1,550. And the incidence and related factors were analyzed. And this is the first part of our results. Between 2009 to 2019, the co-infection rate of HIV and HPV was 10.9%. And the entire cohort will follow up, observed for nearly 7,800 person years, and the median follow-up year was 4.7 years, and the last follow-up time was until December 31, 2020. And up until the last follow-up, a total of 126 cases experienced HBsAg seroclearance, and the incidence rate of HBsAg seroclearance was 1.7 per 100 person years. And this is, we also compare the baseline characteristics of study participants in the population in our study. They are mainly middle-aged young men and was mainly transmitted by sex, and the media baseline CD4 low was relatively low, and the HIV RMA low was very high. And we also 1,013 were isolated for the HIV genotypes, and the distribution of HIV genotypes was consistent with the distribution in southern China. As we can see from the table, the patient who has HBsAg seroclearance have no difference in age, gender, and the transmission way, CD4 count low, and HIV low, when compared to the patients with HBsAg persistent. And the patient with HBsAg seroclearance have lower baseline HBV DMA levels. And this is another characteristic table. And we also analyze the distributions of HBV genotypes. And as we can see from the table, HBV genotypes is the most prevalent, and followed by the genotype C. HBV genotype B. This result was consistent with the HBV monoinfections in southern China, and the patient with the HBsAg seroclearance tend to have a lower baseline HBsAg levels. And finally, we use co-regression analysis to identify the factors associated with HBsAg seroclearance, and we find that HBV genotype B baseline HBsAg lower than 1,500 CLI and ALT elevation greater than twice upper limit of normal during the first 6 months of CART were the independent predictors for the HBsAg seroclearance. This is the main finding of our research, and we also use to Kaplan's Miro analysis to display the relationships between the factors and HBsAg seroclearance. And this is our conclusions. The rate of HBsAg seroclearance was low in HIV and HBV co-infection patients after CIRT in southern China, and a more effective way should be conducted in HIV and HBV co-infections, and lower baseline HBsAg levels, HBV genotype B, and ALT elevation during the first 6 months CART were the potential predictors for HBsAg seroclearance. This entire study was conducted under the guidance of Dr. Linhua Li, the director of our infection disease centers, with the participant of many clinical doctors, as we saw in the picture. This the last slide, and this was our hospital, the Guangzhou A People Hospital, which is the largest infection disease diagnosis and treatment centers in southern China, and have an intensive experience on infection disease. We welcome exchange with you. Thank you.